Is it possible to get colon or rectal cancer in my 20s? Well, find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting right here by my side. Thank you so much for joining us for another podcast. If you are a first-time listener, we welcome you and we are so excited to have you on the journey.
So excited.
And if you are a regular listener, we thank you. We love you. We appreciate your loyalty to this podcast. This is a journey that we are all on. And we've been podcasting for a few years. We have taken some pauses here and there, but we are back on the saddle, podcasting again. And
Yeehaw.
That's right. And so we're like really excited to be here and that you're here with us. So let's go ahead and get started. So is it possible to get colon and rectal cancer at such a young age? Absolutely. Okay, there. Well, thank you for joining us for this
podcast.
Yes, absolutely. It is. It is.
And Dr. Cruz, what brought on this podcast for you?
Well, this is being triggered in my mind and my heart because I have recently had a young patient in their 20s that came in to see us for a little bit of rectal bleeding, which was thought to be due to hemorrhoids and
People mostly think that they're bleeding.
99% of the time it's due to hemorrhoids. 99% of the time rectal bleeding is due to hemorrhoids, but not always. And also this patient had some other issues. I mean, like nothing though that was drastic, okay? I mean, we see patients every day who come in with some diarrhea, some bloating, abdominal pain, maybe constipation, maybe a little blood on their toilet paper when they wipe, but nothing that was just out of this world.
Like no weight loss.
No weight loss,
like
no night sweats, fevers, chills, nothing like that. And lo and behold, that patient ended up having a huge mass in the colon, in the rectum.
How old was she?
Biopsies came back in their 20s.
Well, how old?
In their 20s,
exactly?
27.
27 years old.
Yeah.
Okay.
27.
Okay.
And biopsies did come back showing cancer. And, I have, in the last probably couple weeks, I've had a couple young people that I work with ask me, hey, I've had some rectal bleeding. I mean, not a lot, just a little bit on toilet paper. And, what do you think? Do you think I should get a colonoscopy? Absolutely. And I've always said this. Actually, when I started my training, in my very first month of training of gastroenterology fellowship, I had a 26-year-old that had a colon tumor that was cancer. And so that really impacted me because here it's the beginning of my training, and I'm just like, oh my goodness, is this possible? Yeah, it is possible. It is absolutely possible. You don't have to have family history of colon cancer. You don't have to have, you don't have to have weight loss, okay? I mean, look, if you are having issues, and this is what I've told these young people that have recently spoken to me about this, one of them being my son, who's 25 years old, I'm like, get in, see a gastroenterologist, and get your colonoscopy, okay? And I've always trained my nurse practitioners that work with me that if they come in with any amount, small, obviously large, they're going to get a colonoscopy. But even if it's a little bit of bleeding, that person needs a colonoscopy. And I know that in the gastroenterology guidelines, that may not be I haven't even looked lately as far as the guidelines for rectal bleeding. It's been a while since I looked at those guidelines. But I know that in the past, it was like, well, if it's just like some blood on the toilet paper and it's not in the stool or anything like that. But my philosophy, especially because of that first month in my training where I found a tumor in this 26-year-old, my philosophy has always been, if they have any rectal bleeding, okay, I don't care if it's a little bit on the toilet paper, rectal bleeding is, we're going to do a colonoscopy because we're going to make sure that it's just hemorrhoids and nothing else more serious. All right. I have had patients through the years, not a lot, thankfully, not a lot, but I have had patients through the years who have told me that they had, some rectal bleeding and that it was treated as, hemorrhoids, and they were never sent to a gastroenterologist, and now it's been years later, and now, they're seeing us, and, we're going to schedule them for a colonoscopy. And I've had probably two. One of them that turned out it was an anal cancer, and the other one turned out it was a rectal cancer. Okay. So, it hasn't been with everyone that's told us, oh, I've been just treated as if it was hemorrhoids, but now I've been sent over to you. So it's definitely something that needs to be evaluated, and I take it very seriously.
And I feel like you're finding so much more in younger people.
Yes,
today.
Absolutely.
Which is why the guidelines have actually gone down for the screening colonoscopy, right? The screening colonoscopy used to be 50 years old. Now they've moved it to 45.
That's right.
Because there's so many findings on these colonoscopies that are being done today. And we have so many young people coming in.
That's right.
With digestive issues that, we're not used to seeing people in our office till they're 40 and 50. Right. But over the last decade, there's been, so many in their 20s and their early 30s coming in with the same issues that we're used to seeing in older people. So, and a lot of that is diet, right? The stuff that
stress,
these people have grown up on. We kind of live in that society of, Dutch Bros and Starbucks and energy drinks and fast food and fried foods.
Yep.
And, we all know the healthier foods to eat. Most of us aren't doing it. Right?
That's right.
And so it's just leading to disease sooner.
Yeah,
right?
It is. Absolutely. Just in the last, just in the last month, I've had at least 5 or 6 patients in their 20s and 30s where I did a colonoscopy on, where I found polyps, and the polyps came back being precancerous. Now, precancerous is still benign. Okay. But those are the polyps that you want to get out of there. Any polyp that I see, I always take it off, no matter what. Because I have to pull it, I have to cut it out, let the pathologist look at it to determine what kind it is. But those precancerous polyps, imagine that 25-year-old that I found a few precancerous polyps on. I removed them. But if they didn't have a colonoscopy until the stated recommended age of 45, they probably wouldn't have even made it to that age. Those precancerous polyps over time will grow. And yes, they grow slowly, but they're going to grow, and they're going to, that person would probably have presented with a cancer before the age of 45. So I tell them, oh my goodness, it's so great. It's a blessing. It's a blessing in disguise. Yeah. That you came to see us for whatever they came for.
Abdominal
they had
pain or
diarrhea, whatever. And that we did this because lo and behold, we found those polyps. Now, those polyps are not the cause of those symptoms, but it's a blessing in disguise. Yeah. We've probably just saved that person from developing colon rectal cancer.
Right. This is the same reason I tell patients who come in and they've got diarrhea or constipation and we're going to schedule them for a procedure. But then, let's say they start taking enzymes and probiotics and they start feeling better.
Right.
And they're like, oh, I want to cancel my procedure. I'm like, do not cancel your procedure. Use your symptoms as an excuse to get scoped.
Absolutely.
Just because of everything you're finding for that reason. Exactly. Right. Even if we go in there and you find polyps that aren't the cause of the constipation or diarrhea, at least you can get that stuff out of there, before your screening, would normally be. So that's one, always do the procedure to rule out really, really bad things.
Right.
And 2, do it so that you can get stuff out of there that might not be really bad right now, but might be really bad in 5 years. Right.
I agree. Amen to that. And so like Tina said, the age for a screening colonoscopy in an average risk person, okay? That means it's not somebody who has a family history of colon cancer and their dad that was diagnosed at the age of 35. That automatically changes the recommendation. But just average risk, meaning they don't have, significant family history. They're just average. Which in that case, you do want to be average. But average risk, the guideline has changed. In 2018, the American Cancer Society changed it to 45. It used to be 50. 50, actually, it was always 45 in African American, but they changed it to 45 now for everyone. And then the Gastroenterology Societies finally endorsed it just last year. But we started doing it back in 2018. We started going with the age of 45.
Yeah, and at that point, before the GI associations came on board, a lot of the insurances hadn't come on board.
Right.
So if you were 46 or 47 and wanting to go for your screening colon, your insurance wasn't going to cover it. Now that the GI associations are on board, now most of the insurances are covering it. I mean, we do still tell patients, if you're between 45 and 50, like check with your insurance before you get it done, just to make sure. But for the most part, most people that are checking now, they're saying it's being covered.
Yeah. So
no excuse.
That's right. I mean, look, if you are 45 or older and you haven't had a screening colonoscopy, get in there, get your colonoscopy. If you're in our area and you don't have a gastroenterologist, come see us. If you have a gastroenterologist or wherever you are, get in to see your gastroenterologist or get in to see a gastroenterologist and get your colonoscopy, because it could save your life.
Yeah,
it could save your life.
Preventable cancer.
Absolutely.
With such a simple procedure. Honestly, like the worst part is the prep, right?
Yeah.
Then they knock you out. You don't remember anything after that. So
she doesn't know. She's getting her colonoscopy next week. Then she'll know.
Then I'll know.
But it is true. The prep is probably the worst part. But you know what? I'm going to tell you something. I would rather you suffer with the prep than to suffer with a diagnosis of colon or rectal cancer. Okay? I mean, I'm sorry, but that is the truth. I would rather you go through it and be tortured with the prep. Get the exam done. You could save your life. All right? And be around longer for loved ones. And just because life is awesome. So, and of course, if you are having any issues at all, rectal bleeding, for sure get in there and get evaluated and get a colonoscopy and make sure that everything is okay.
Don't make excuses.
That's right.
It's not worth it.
It's not. So look, we'd love to help you get better from your digestive issues. If you're having issues, we're here to help. And, the easiest way to get a hold of us or to get in contact with us, to engage with us, is to go to our website, drlizcruz.com, and you'll find it on the title. You'll find it everywhere on the podcast. So please connect with us, okay? And go and leave us a review. Give us a 5-star review, because it'll actually help other amazing people like you find us easier, okay? And if you want to take Tina and Liz along with you on the ride in the car, subscribe to us, okay? Because then you will have access to all of our episodes. And we have a library of hundreds of podcasts, and we will continue to do this for you because we love doing this, and this is our gift to you. So thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.